Hello, 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 bonjour, connecting community. Happy 2024, Happy New Year's. I know we're already in February, but I wasn't here last month, so hope you're already having a really good year. And I would like to say welcome to Connect Here in Canada Facebook Live series. If it's your first time here, my name is Christiane Basilio. I am an audiologist and I have a doctorate degree in audiology. And I have been helping patients for about 20 years now. And we always appreciate the likes, the hearts. So don't hesitate to please give some love so we can continue coming back here every 2 months or so now. And as usual, we'll have time to answer your questions by the end of the video. So if you have questions, add on the comments below and I'll be able to see them and we'll do our best to answer all of them, okay? So this week, from February the 5th to 9th, we recognize a Tinnitus Awareness Week. I'm not sure if you're aware of that, but tinnitus affects a significant portion of the population worldwide. It estimates about 10 to 15% of the population perceiving tinnitus and bothersome tinnitus, okay? But for some patients, that can really negatively impact their quality of life. And that's why we brought this topic back to this live with the hope that we can answer some of your questions and guide you through this journey that can be a little, stressful, let's say that way. Okay. So to join me today, I'm very excited to introduce you to my colleague and fellow Luciana. She's an audiologist as well. So let me just get her to the stage. Hi, Luciana.
Hi, Christiane. It's a pleasure to be here today. So I hope to clarify some questions about tinnitus and any other questions that people might have. So it's a pleasure.
That's awesome. Thank you so much. So can you just tell a little bit about yourself so everybody knows you a little bit?
Okay. So I am a doctor of audiology. I'm originally from Brazil. I have more than 25 years of experience with clinical research experience too. And now I'm here at Connect Hearing and Word of Hearing Toronto.
Okay, yeah. So if you haven't had a chance, if anybody that's watching us live in the Toronto area, we have this amazing office that calls World of Hearing. And it's a very unique concept with the latest technology. So I would encourage you to stop by and say hi to Luciana. And
yeah, it would be a pleasure to see you here.
Yeah,
come to visit me.
Exactly. Okay, so I can see already we have, people joining us. That's great. Thank you so much. I will try to see some comments in the middle of this conversation here. But as I mentioned, if you just join us, we'll have time to answer your questions at the end of the presentation. Okay. So I think the very first question, Luciana, that some patients don't know really what they're suffering, and we come with this word tinnitus or tinnitus, right? Can you talk and tell us what is tinnitus?
Tinnitus is a perception of sound in one ear or in both ears or even in the head that is not associated with any external sound. So sometimes people describe tinnitus as a ringing, buzzing, or hissing. It can be described as running water or chirping. So sometimes even music. Some people refer that they have a constant music in their head, and that is also considered a tinnitus.
Okay. Yeah, so that's very good to mention that because I think buzzing is usually what people think about of tinnitus, and they come to the office and they say, no, I don't have tinnitus. I don't have a buzzing, right? But they do perceive other type of sounds that you just mentioned. So that's an important information there for sure. Okay. So another question we often get in the clinic is what causes tinnitus?
So believe it or not, tinnitus is not a symptom. It's not a disease. It's a symptom. So, and it can be originated from any number of conditions that it's affecting the auditory pathway. So the process by which tinnitus is generated and as a result of these pathologies is still not understood. So, and that what makes any attempts to cure very difficult. And the most common health conditions that are associated with tinnitus is hearing loss related to noise exposure, like music or loud equipment, aging related hearing loss, ear infections like otitis media, head or neck trauma. So if you got into a car accident, sometimes people refer tinnitus right after that too. Some medications can cause tinnitus. Emotional stress like depression or anxiety, or even earwax. So in the case of earwax, it can be very temporary. So once you remove the earwax, then the tinnitus is gone. But if your tinnitus lasts more than 6 months, it's most likely that it won't go away by itself. So you should have a tinnitus assessment and discuss some possible treatment.
And look for help there. Yeah. So another very common question we get is, because usually what bring more patients to the office is more their perception of the sound, the tinnitus, than a lack of hearing. Okay, and a lot of patients feel that the tinnitus is causing hearing loss. So can tinnitus cause hearing loss?
No, tinnitus can affect your concentration, but it definitely doesn't cause a hearing loss. And in many cases, tinnitus is due to a pre-existing hearing loss. So to better understand tinnitus, so you need to understand our auditory system and how we hear. So hearing is a series of events in which the ear converts sound waves into electrical signals that are transferred to the brain, where they are interpreted as sound. So the sound passes through the outer ear, that's the ear canal, the middle ear, the ossicles, and the inner ear, that is the cochlea and the balance system. And that's all before the sound is converted to electrical signals and sent to the brain to be processed. So as I said before, tinnitus can originate from any number of conditions affecting this auditory pathway. Oh, and you asked me, the most common causes are noise exposure and aging-related hearing loss. Because those type of hearing losses, they are related to the damage to the hair cells in the cochlea. So the brain stops receiving correct information from the cochlea, and it causes a abnormal neural activity that is perceived as tinnitus.
Okay, and this is a great, I would say, it's very normal. People really like to see this photo. You have a good idea what is happening in our cochlea when there's damage in our hair cells. Okay.
So,
That's
and because
great.
of their damage, that it's very visible there. So the signals are not sent to the brain a proper way. So they
A
will,
proper way. So then they start
the
perceiving
neural
this other
activity, yeah.
sound. Okay. All right. And you mentioned, okay, once the sound goes into our ears and then the information is sent to our brain, and that's our brain that really decode that, give the information, right? The helps to understand which kind of signal is going in the ear. So what's happening actually in our brain when we start noticing tinnitus?
So once our brain is aware of the tinnitus, it can start fixate on that sound and pay more attention to that. So, and several factors can influence our emotional reaction to this new sound. So before anything else, we have to ask ourselves, is this sound annoying or it doesn't bother me? Because if we negatively respond to the tinnitus, it can be more dominant in our lives and our stress levels will increase.
And then it creates what we call this vicious circle, right? So you
Yes.
kind of start having that negative thoughts. Oh, I cannot live with the sound, and then really start affecting your quality of life. Yeah. And of course, when we say that, we know that's not easy. When you first notice, it's something that create, right, that worry of what's happening in our brain, right? But it's important to go for evaluation and try to find out before this worry really escalate, because that's when we really see in the clinic that becomes very the impact in their quality of life really gets them. Okay, so what are the most common effects of tinnitus? So we say that it goes to the brain, and now this emotional reaction to the sound that we create, and this worry, these fears. So when does a tinnitus really becomes this disorder? Like, what are the most common effects of tinnitus?
Yeah, so it happens when we have this negative response to the sound that we perceive as tinnitus. So, and it becomes a disorder when it's starting affecting our daily activities. So sometimes we feel anxious, so it's anxiety, fatigue, stress, depression, trouble sleeping, because the tinnitus can be better perceived at night when everything is quiet, right? So lack of concentration, or even sound intolerance. So people can become very intolerant to sounds around them.
Mm-hmm. And is there a way to prevent to develop tinnitus? Like, can we do anything that we to prevent tinnitus?
Yes, because tinnitus is one of the causes is noise exposure, right? So then you can prevent tinnitus by limiting your exposure to loud noise. So you can wear hearing protection whenever you are exposed to loud noise at work. Wearing hearing protection when using equipment or machinery during, such as lawnmowers, chainsaws, when you do some repairs at home. So it's important that you wear your hearing protection at those moments too. You can monitor noise levels when you are doing some hobbies, like when you go to a fitness class or snowmobiling, motorbiking. So it's important also to wear hearing protection in those
Yeah, a
situations.
lot of recreation activities that
Yes,
sometimes
and we
we
don't
don't think
realize
about it.
exactly.
Yeah,
So it's still noise exposure, right? You can
yeah.
wear hearing protection when you go to concerts, right? So and avoid to be close to
Sport
the
events,
speakers.
I would say sport events is a big one as well. Can
Yeah,
become, can be very loud,
yeah.
and then it's much easier, let's say, if we could prevent one of the main causes of tinnitus than after having to treat that
To treat.
symptom, right?
Yeah,
So that is an important information for sure.
yes.
So what, like, if someone start noticing a sound in their ears, like what is the very first thing that they need to do? Like, which is the first professional that they should look for, and what is involved in like tinnitus evaluation, let's say?
So since 80% of the population with tinnitus have some degree of hearing loss, so the first professional to look for is to look for the audiologist, right? So then during the tinnitus evaluation appointment, so the audiologist will review the medical history and go over a couple of questionnaires to evaluate the impact of tinnitus in their daily activities. And because of the source of tinnitus might be the hearing loss, so then a full assessment and specific tinnitus measurement is required to ensure a comprehensive understanding of the audiological profile and needs of the person in order to recommend the best management plan for them. Sometimes a referral to the ENT, that's the ear, nose, and throat doctor, or a mental health professional might be also required before we start the treatment plan.
Talk about any treatment, yeah. And then as Luciana said about this specific testing that we do for tinnitus, that is usually a paid service. Okay, so normally if you go to a hearing clinic, you might see complementary hearing test, and we do a basic testing. But if we needed to do a more comprehensive testing for tinnitus, that usually will have a fee. Okay, and then at Connect Hearing, we charge about $120 for that assessment. Okay, but you have a full test. And then of course we're going to go through a full tinnitus management treatment plan, okay, with you.
Yeah.
So beautiful. So what happens? Okay, we went through all this assessment that can be a quite long testing, and can be very stressful for some patients. So it's important to have a good professional to help you along the way of that assessment. Once you have that testing, and we do recognize that you are suffering from tinnitus, what are options for treatment? Because that's always the main thing that people come to us and they say, please, I don't want to hear the sound anymore, right? They are always looking for this cure. So what are the treatments out there, Luciana, for tinnitus?
Yeah, it's important to be clear that in tinnitus management, we focus on the effects of tinnitus in each individual. So it's important to evaluate how the person experienced tinnitus. So we focus on the effects of the tinnitus, not in the cure, right? So when we do our tinnitus care program, we follow a personalized treatment option that will include the tinnitus evaluation, and when we can provide recommendations and management strategies to intervene for their tinnitus. And that includes some tinnitus activities treatment that we can offer based on Dr. Richard Tyler research, tinnitus retraining therapy, cognitive behavior therapy, mindfulness therapy, or in case they have hearing loss, so we can offer hearing aids or hearing aids plus a tinnitus masker, and or even sound therapy machines. So all those type of treatments are available here.
Yeah, we just to make it clear, on the side of cognitive behavioral therapy and mindful therapy, that's not something we audiologists are licensed for. That we do use principles of that, cognitive behavioral therapy, but we would of course refer you to a specialized professional for that if needed. Okay. That's perfect. And then you mentioned about, okay, if they have a hearing loss, as the majority of people, 80% of patients that have tinnitus, they have some degree of hearing loss. And then usually a masker or a type of amplification, it is required alongside the therapy sessions and then the strategies as well that we're going to be teaching you. What really, the amplification, how much the amplification, the noise generators can help a patient? Like what really happens in our brain when we set that up, let's say?
So let me see. You were talking just about the sound therapy, right? So
yes.
Don't understand why I need to wear a hearing aid if I don't feel like my hearing loss is really impacting my life. But the sound therapy has this analogy with the lamp. I don't know if you can see that right now. So to help explain the benefit of using sound to manage tinnitus. So this visual picture can help because tinnitus is represented by the brightness of the light from that street lamp in the dark. So in the evening, the light coming from the lamp is very noticeable because there's no other light sources. So then you can see that, right? In comparison, if the street lamp is on during the day, the light is much less noticeable because you can see everything else that it's in the surroundings, right? Due to the presence of the daylight. So in the case of tinnitus, adding external sound has a similar effect. So by adding sounds to the environment with the hearing aids, so the listeners are no longer focused on the tinnitus, but also in all the sounds around them. So that's how the sound therapy or even the hearing aids alone can help a lot with tinnitus.
Yeah, and sometimes it's just not only wearing a hearing aid, but also having other type of sound sources in the house as well. Because I noticed some patients, they might get hearing aids, but they might live in a very quiet place. So they're not really getting that stimulus, right, happening during the day. So those little things that when we go through the assessment, we kind of need to understand really your lifestyle, like other things that can help us to help you to have different strategies, let's say during the day, and help your brain not to be focusing and creating so much attention to that sound, right? Because the idea, as Luciana mentioned, we want to have your brain distracted. So it's really to help our brain to hear that sound as a neutral sound. It's not like a sound that should be taking over your life, let's say, right? So then you once you add that sound generator through a hearing device or just through a environmental speaker or something, that really helps to not having that quiet noise, what can trigger the sensation, the perception, let's say, of tinnitus. Right?
Yes.
Yeah. So I think that's all we already had as questions, right, Lou? That we normally get in the clinic. I do see here we have quite a bit of questions on our comments.
Oh,
so I think
wow.
I'm just gonna
I'm curious,
go
yes.
about that. Let's see. So Barbara, so thanks everyone that's adding all these questions here. Really appreciate that. Barbara is asking, how about tinnitus in one ear only?
So, yeah, sometimes people just have this sensation in one ear, but to be sure from where the tinnitus is coming from, you should get the hearing assessed. So we do the hearing test. And then even if you feel like it's coming from one ear, if you do a treatment in one ear, it's most likely that it will migrate to the other side. So we have to have a very good hearing evaluation to provide you the best treatment to get rid of this tinnitus, even when it comes in one side. Only if you have wax in that side. So that's, again, you have to go for a evaluation. So then that can be removed. That most likely to be the cause of tinnitus. But if there's no wax, so then we're going to see, even if you have one in one side, the best treatment for you.
Yeah, and this is usually when you have the same type of hearing loss, let's say, or even normal hearing both ears. There are some cases like Luciana, I don't think you mentioned that yet, but some cases if you have like a sudden hearing loss, or there are some other ear conditions that could cause tinnitus just in one side. And then if that's the case, if we call it unilateral losses, then we would definitely have to refer you to an ENT to see if there is anything they can do about it before we go over any treatment plan.
Yes.
But as Luciana mentioned, the majority of time, people will have hearing loss very symmetric in both ears, but they might perceive more in one side. And then, as you said, sometimes it just shifts. And once we are doing the test, oh, now I hear in the other side as well.
Yeah.
And it's hard to explain why that really happens, but that can happen. Okay.
Yeah. No, and just like to give an example, so I had a patient 2 weeks ago with this condition. So he came, but it was a sudden hearing loss in one side. He had been cleared by the ENT, and the asymmetry was really big. So then we were treating only the side that he has the biggest hearing loss and tinnitus, and he's quite happy, by the way.
And he's quite happy. It made a difference for him. Okay, that's great. Okay. So, all right. We have something here. Oh, I think they're just asking my question. My question is main treatment of semicircular canals and cochlear. We're not going to go there for that. Tinnitus for today.
It has to do, with the balance system.
Yes, it would be very different subject here. So, Louise, how do the hairs get damaged? She asks, could wearing earplugs damaged our hairs in the ear canal?
No, it's the opposite. Right?
It's the opposite.
Earplugs is there to prevent the damage caused by loud noise or noise exposure, right? So it creates a barrier so the loud sounds don't go inside to the inner organ, the cochlea, to damage. Sometimes it's the sound pressure level that is too elevated, and that gets the cells to be destroyed. So that's how noise really affects and causes hearing loss. So you should get ear protection. Earplugs are really good for that.
And as I saw the photo I showed before, there's many options out there. So you can have disposable, reusable, you can have a custom plug. So there's definitely, options that you can choose from for you to feel comfortable as well.
Some with filters, yes, because some musicians, they need to still hear their instruments. So there's ear protections with filters. So we have a variety of
options. Yeah. How does one get a tinnitus measurement? Do you want to talk a little bit about just what we do? So usually we're going to measure the pitch, the loudness of tinnitus, right? Yes. And then we also measure, we add some masking to see what is the effect in your ears, like if you don't notice your tinnitus after masker for a while. And there is this test we call a residual inhibition. So basically, once we turn it on, the masking, we'll wait a minute or so to see if you don't notice your tinnitus any longer. So that kind of help us to, it just brings you some answers to what you feel that's not in your head, like you're not imagining anything, the sound is there. And it also helps us to find out what's the best treatment, or even how we can adjust better hearing aids in order to for you to not notice your tinnitus as much. Okay. All right. So, Stanley, good morning, Stanley. Do you recommend surgeons to clean out sinus blockage? I would say that, yeah, I would definitely go for your ENT for that.
Yeah. And you can feel like fullness in your head, right? Yeah, and that's not good. So yeah, definitely.
And there are supplements that are advertised for tinnitus. Can we talk about that?
Yeah, so there is no medications that can cause cure for tinnitus, unfortunately, and people ask us a lot about that. So yes, there's some medications that can increase the blood flow overall in your body, and that's good for your body, right? But in any way, it's going to cure tinnitus. So if we have some medications that actually can cause tinnitus. So for that, we recommend you to see your doctor for clearance on what type of medications you were taking and if that is the cause of your tinnitus. But definitely you have to come for a hearing assessment and then go from there. So then we can do some more in-depth questions. So then we can help you with that. But medications.
Yeah. So there's no, those miracle, pills, no, they don't work.
They don't work.
Yeah. Okay. I think that's all the questions. Let me see. I had here. So that's great. Okay. So I really appreciate everybody that joined us today. And if you do have more questions later, you can always add on the comments. We can look back and go back, answer back to you. And thank you, Luciana, for joining us today. It was, a pleasure having you.
You're welcome. It was a pleasure.
Oh,
and I hope to see many of the people that are in Toronto area here if they need assessment for their tinnitus or any help with hearing. So we are here to help.
That'd be great. Yeah. So stay safe, stay connected, and I'll see you again maybe in 2 months or so. Okay. Right. Bye, everyone. Take care. Bye-bye.